Dr. Samadi, there seems to be so much misinformation about COVID, how vulnerable we are, how serious it is, what we should do, what we shouldn't do. If you could just speak to the nation and have a primetime address, what would be the most important message you would give to the American people medically?
The biggest message I have for the American public is don't let fear and panic get ahead of your life. You know, Governor, the DNA of any pandemic is being scared, being fearful. And when you start getting a lot of misinformation from some of the authorities, some of the doctors out there, that even magnifies the panic level, and that's where we are. Don't forget, this disease, we called it the invisible enemy. We had no idea what was coming to us. Overnight, we heard about this virus coming in. The Chinese government did not give us a lot of information about this virus. The human-to-human transmission was not really known. And now we find out that the whole WHO, along with the Chinese government, were not coming forward, and they did not give our president and the country all the information we needed. So we had to learn everything on our own. And so we are finding out that this virus has been around since August of last year. So what that means is that probably millions of Americans may have antibodies. I've seen in my own practice so many patients that have come and said, look, I have no symptoms, but I have the antibodies, which is fine. That means that they have recovered well. The biggest news and the biggest decision that we made was the fact that the president of America, President Trump, put a travel ban against this virus. That saved millions and millions of Americans, and people need to understand that the first rule of any infectious disease or virus is isolation and containment, and that's what he did. Since then, we have learned a lot. The fact that, you know, the mixed messages, you may get this virus from the surface, you may not get this from the virus. Asymptomatic people are not going to be contagious. 24 hours after WHO took it back and said asymptomatic people are contagious. As a result of all of these mixed messages, people are confused, they're losing their trust, and it's our job as someone who cares for this country, and you know how much I care about America, is to really come forward and give the facts to the best of our knowledge. But I want to tell the public that we have made a huge progress. We are in very good position. We have many treatment options, which I'm happy to talk to you about. Our hospitals are extremely equipped, and I believe in the healthcare system in America, and we will win against this virus. And we've come a long way, and this virus is no longer invisible. Now we know exactly who he's going after, we know who he targets, and we're more than capable of taking care of it.
We locked the economy down. We told people to stay at home. We were told that if we didn't, we would lose 2 or 3 million people to death. We did lock down, and we're, you know, at a horrible number of almost 150,000 people, but nowhere near the millions. Did we do the right thing? Did we do too much? And are we still doing too much in light of what we now know?
We understand that the initial models were completely wrong. Remember, they came up with a model that 2 million Americans are going to be in body bags. And the media runs with this, and the scare in the country was tremendous. So at that time, not knowing exactly what was coming to us, almost like a war overnight, the lockdown was probably a way to, as we call it, flatten the curve. Buy some time, make sure the hospitals are equipped. Nobody ever expected to hear a news like this overnight. Get our ventilators in place, get our doctors equipped, find out exactly what this virus is doing. So the initial lockdown was basically to flatten the curve, to buy some time for the hospitals, and we did. And again, the credit to the president. He was one of the few presidents that was able to bring in the private sector and the public sector and put them together and ramp up these ventilators, medications, the clinical trials that would take years, and basically cut through the red tape and give us everything that we needed. As this went on, the narrative changed. And basically now we see that as the number of these cases go up, states like California, the 5th strongest economy in the world, just by the rise of the cases, they go back to the lockdown. This doesn't make any sense. And if you look at my Twitter feed, I wrote, lockdown is not a cure for coronavirus, for this Chinese virus. And the reason is because you're going to do more harm by keeping people at home. First of all, we're finding out that when you're at home, the risk of passing this to your family, if you have friends coming over, is higher. You have air conditioning, so this virus can get over there, as opposed to being outdoor. And the other thing is that the anxiety, depression, psychological issues, millions of people that have lost their savings and committing suicide, child abuse, and on. Now the risk of that lockdown is way more than this virus, and I think we're overdoing it. This is United States of America. We should be able to chew and walk at the same time. We can take care of this virus without paralyzing our country and our economy, and that's what people need to know. I think today, when we see the death rate coming all the way down and it's kind of flat, to mandate masks across the country, where we should have done this in February instead of now, or going to lockdown when the economy is about to open up and people are starting to open up their stores, back down to lockdown again. This is back and forth is really devastating, and I don't think it's necessary.
I got to get some quick answers on a couple of more questions I want to get to. One, I heard an epidemiologist say that this is the first time in history in a pandemic where we isolated the healthy people rather than only quarantine the sick people. Is that a fair assessment of what we've done differently in the Chinese virus?
It's a good assessment by this doctor, and it's always the case that we take care of sick people and we quarantine them and we let the healthy people out there. The argument against that is that since asymptomatic people, and we still today, we're getting mixed messages. Today, as we are, the American epidemiologists and Dr. Fauci and others are saying that asymptomatic people are still can pass this virus to others. Many doctors have argued this, that if you're asymptomatic, that your viral load and the amount of virus that you have is so low that you may not be able to pass this. And we've seen from WHO, they mentioned the fact that through contact tracing, countries such as South Korea and Singapore, the chance of asymptomatic people passing this virus to others is very rare. And then they change their mind. So if that theory is correct and asymptomatic people are not going to pass the virus, then there's absolutely no need to really isolate them and put them on quarantine. So again, this is part of the mixed bag. I think that if you have no symptoms, the risk of passing this is fairly low, but we have to be very careful. Don't forget, Governor, they always come up with the best scenario and the worst scenario. And it's always easier for them to paint the picture of the worst scenario, because when it gets better, they become the iconic heroes and they are the winners. But the public need to know the real science and real data and not just this mix of messages.
Dr. Samadi, two big issues every American sort of is dealing with. One is, should schools open? And two, should everybody be forced to wear a mask everywhere they go? What's your thought?
The school needs to open up. And part of the reason is because we are seeing the data coming from many European countries, over 22 countries in Europe, that they have the data and the record that shows that it's absolutely safe to open up our schools. The risk of children getting this virus, transmitting it to the elderly, I'm not talking about kids visiting nursing home, but to the parents is very low. And the risk of dying the children from this virus is extremely low, close to zero. Now, the risk of keeping them at home, the loss of education, child abuse, not getting the nutrition, and all of that is way further than opening up our schools. So we're all for opening the schools. We need to protect our teachers. I got a lot of emails that, Dr. Samadi, you may not care about the teachers. That's not the case. We love you guys. But you have to understand that if you're an older teacher with diabetes, obesity, high blood pressure, you should stay home and you should do this distant teaching. A lot of the teachers for K1 to K12 are much younger, and by rearranging our schools, by new guidelines, by making sure that there is social distancing, wearing masks, protecting our teachers and students, I think it's time to open up our school, and I will absolutely feel safe to send my children to school.
20 seconds, mask, should we wear them? Is that a good thing for us, and for how long?
Well, I don't want this mask to become our new norm. If you look at a lot of people on one side of the aisle, they think that their liberty is taken away, their civil right is taken away. On the other hand, there are a lot of studies that shows that if the entire country wears a mask, they would be able to reduce the risk of death and infection. Somehow we have to compromise. I think if it's a short period, the Americans have responded. I look at New York as to how Many of them went into lockdown and responded, and the rest of the country the same. So I don't want this wearing masks to become our way of life, our fashion, and the new norm. America is not China. We're not used to wearing a mask. And there's also an art of wearing the mask, which is very difficult. You see, even Dr. Fauci in this stadium, he has his mask around his neck. It's just difficult to wear it for hours and hours and hours. But I think we need to respect each other for the time being. If it helps other people to reduce the death, and if it helps reduce the infection rate, I think for the small transition point, we should follow the law and wear the mask and get rid of this virus and move on. But there's a lot of lessons governors learned that we need to bring our healthcare here in America. We need to become independent of China. We should never allow 90% plus of our antibiotics made in foreign countries for national security and a lot of other reasons. We need to become independent, and that's one of the biggest lessons learned from this pandemic.
Well, I know that a lot of people who see me say that I look much better with a mask over most of my face, so I will continue to wear the mask. Dr. Samadi, thank you for joining us. What a pleasure to have you with us.